Hey friends, in this video we're going to talk about sleep apnea, some of the common misconceptions, and how we utilize or approach sleep apnea in our clinic. So first of all, let's dispel some of the myths about sleep apnea. One is you think it can only happen to someone who's obese. That's kind of a common one. When we talk about sleep apnea, people will oftentimes say, I'm not overweight, or why would I be affected by that? Well, the problem is it all ultimately comes down to your airway. Let's say this is your face here, that's your nose, for example. And so it all comes down to your airway and how that's getting blocked. Now the problem is when someone is overweight or specifically has a very thick neck, they have increased pressure and tissue in here that is then going to start to impinge on that airway and make it a little bit smaller. Now that's not just limited, or that's one route that the airway can become smaller, but it can also be affected by the position of your jaw. If your jaw is a little receded, it's too far back, that also pinches off that airway. This also can have a lot to do with how you're breathing at night, whether you're breathing through your nose or through your mouth. We're all supposed to be breathing through our nose optimally, but when you sleep and you lose, well, if you have chronic allergies or congestion and you just can't breathe through your nose, then you're relying on breathing through your mouth, which then will cause your tongue to become lax, fall into the back of your throat, and that will clog up your airway. So, your tongue, your jaw, your neck, and just your ability to breathe can all have impacts on how effectively you're breathing at night. So it's not just limited to weight, and the effects aren't just limited to weight. I've seen people who are totally normal, healthy weight, totally healthy across the board, but have sleep apnea because one of these structural elements is thrown off. And what does that mean? Well, it means that every night when they're falling asleep and you're trying to get into your deepest levels of sleep, so there's 4 levels of sleep, each one getting progressively deeper. So let's say this little line here is you sleeping, you start to go, you're getting into the deeper levels of sleep, and then you have an apnea. An apnea is a moment where you stop breathing at night because of maybe an obstruction. So obstructive sleep apnea, like your tongue, like your neck, like that airway getting contracted. So you hit an obstructive sleep apnea event, you lose oxygen, your brain freaks out, it wakes you up, or at least brings you back up to a less deep level of sleep. So then boom, you shoot back up here. Now you're back into that shallow sleep. Your body wants to get to that deep sleep where a lot of restorative action happens. So you start to go lower again, lower, sleep apnea event, boom, pulls you back up. So you end up doing this kind of zigzag pattern up here in between, the shallow to mid levels of sleep, and you never really get into, these really deep levels of sleep where a lot of restoration is happening. So that's how people can wake up in the morning after 8 hours of sleep and still feel tired, still wake up with a headache or feel exhausted or just not get that restoration. I've also seen a lot of muscle tension come from people who have inhibited sleep, because when you don't fully get into these deep levels, when your brain doesn't totally turn off, your muscles also don't totally turn off. So you can get to a place where you're laying there all night and you should be restoring, but really you're just kind of treading water and you're ultimately not getting the depth of restoration that you need. So that's why we encourage our patients, depending on their risk factors and certain markers on blood work, to do a home sleep study and see if this is an issue, because people you would never suspect can show up as having sleep apnea, and that's a huge chunk of their life, a huge stress on their body that's not being addressed. So hope you found that helpful. Look into more videos as they come out. Thanks for watching.